President of the United States is now leaving to the
clearly, at least from my analysis, and I'm not a doctor like you are, that would
hospital.
suggest this is a much more serious case of coronavirus than if he simply could have stayed at the White House residence.
There is a God. There is a God.
Dealt with it there.
Turn it up, Dad. Turn it up.
This is a big development, and you know,
right there it is.
They've been sort of, in some ways, telegraphing this, being very opaque about it. But there is now a obviously increased level of worry about the president, his health. As Lena was just saying, I don't know what specifically is triggering this. If we know the sorts of things that typically require hospitalization, if someone's having difficulty breathing, if they're having any kind of chest pain, if their symptoms are just progressively worsening, those are all concerns. But Wolf, I got to tell you, I've been reporting on this since 1 o'clock this morning. I think that this is an important call, and it's a right call. I think that having the president and frankly any patient of his age with his vulnerabilities and now with these progressive symptoms, being in the hospital if possible is the right thing to do here, and it sounds like that's what they're going to do. I imagine they're going to fly him over there. They have capabilities at Walter Reed that they simply don't have at the White House Medical Unit. White House Medical Unit's extensive, but they don't have intensive care capabilities. They
I'm
don't
not
have
there.
advanced
Pool in the White House.
capabilities.
It says
So this
WH
is
pool.
it's unsettling,
Joking, I know what
obviously,
that
to
means.
think that the president is now likely going to be rapidly transported to the hospital. But this is what's necessary, clearly, and I think it's sort of been building to this over the last few hours, Wolf.
And as you know, Sanjay, and as I know, I've been there, there's a presidential suite at the Walter Reed National Military Medical Center that's just outside Washington in Bethesda, Maryland. We're now told by a spokesperson over at the White House that the president will be working from offices there at Walter Reed over the next few days. Our Jeremy Diamond is already
I wonder if he's going to golf there, too.
In Bethesda for us. Jeremy, tell us what you're hearing over there. What are you seeing?
Ooh,
I
Jeremy
suspect
got there fast.
fairly soon we'll probably see the president heading over aboard Marine One, taking off from the south lawn of the White House, making a very brief flight over to Walter Reed in Bethesda.
Say hi to good old Blake for us.
That's right, Wolf, and this is a major development.
Talk to him about what's happening tomorrow.
The evolution of this from last night, early this morning, when we learned that the president had indeed tested positive for coronavirus. This morning, the White House and the White House doctor initially describing this as a very mild case of coronavirus, saying that he was having moderate symptoms. We even heard the White House Chief of Staff, Mark Meadows, say that the president was very enthusiastic and had high energy levels. And then came this letter from the White House physician, Dr. Sean Conley, this afternoon, saying that the president had been fatigued. So clearly the situation has been changing. The White House's description of the president's condition has also been changing, and now we are learning that the president is about to arrive at any moment now here at Walter Reed National Military Medical Center to be treated, not just for coming here for tests for a matter of hours, but that he is expected to stay here for several days. I want to read to you, Wolf, the statement that we have from the White House Press Secretary, Kayleigh McEnany. These are her words. She says, President Trump remains in good spirits, has mild symptoms, and has been working throughout the day out of an abundance of caution. And at the recommendation of his physician and medical experts, the president will be working from the presidential offices at Walter Reed for the next few days. President Trump appreciates the outpouring of support for both he and the First Lady. And that is what you were referencing, Wolf, the fact that the president does have a presidential suite here at Walter Reed, that he is able to stay here for several days. But nonetheless, Wolf, this is the President of the United States, somebody who is 74 years old, is in a high-risk category, being admitted to the hospital for coronavirus. That is effectively what is happening here. The White House can describe this as the president working out of offices at Walter Reed, but ultimately he is being admitted to the hospital, Wolf, with coronavirus. This is a very concerning situation, Wolf.
Very concerning indeed. And Dr. Wen, they wouldn't be. We know the president. We know that he doesn't want to advertise that he has any medical conditions at all. For him to have agreed now to go over to Walter Reed and spend the next few days there, this is a serious development and underscores the problems he's facing as a result of being diagnosed with coronavirus.
That's right. We do know that most people who have coronavirus end up recovering. Some patients may never get any symptoms at all. Most people end up having mild symptoms. But for some individuals, and we don't know exactly why, but some individuals do end up having more severe symptoms. And one of the symptoms that we're the most concerned about is shortness of breath, because then you may not be getting enough oxygen. We know that for patients with coronavirus, their oxygen levels could get very low. At some point, they may need support to help them breathe. I'm not saying that that's what's going on with the president, but that is something that we anticipate happening for some of the patients who end up not doing very well. And we also have to remember that the median time between when somebody first